Nashville is an impressive city. I've lived here now for a little over 5 years and can say that there are several things about Nashville that make it a great place for entrepreneurs. One, the town is full of people who can serve as mentors for young entrepreneurs, and they're willing to do that. Secondly, while there's a lot of competition in Nashville, there's also a lot of collaboration. And so companies outside of Nashville find it increasingly difficult to compete with companies inside of Nashville because they each raise each other up. So my advice for entrepreneurs would be to get embedded in the community, find mentors, find people who can give them good advice, even if that's difficult advice, on the quality of their management team and the quality of the business that they're trying to build, and to get a set of mentors and advisors around them to help support the growth of their business.
I really think there's 3 or 4 broad themes to think about in terms of healthcare M&A in 2014. First of all, CEO confidence. So with the economy slowly improving here in the U.S. and abroad, there is more and more CEO confidence in doing deals. So that's witnessed by a couple of hostile deals. Pfizer making a hostile offer for AstraZeneca, Valeant making a deal for making an offer for Allergan, and teamed up with an activist. The second theme, I think, is cheap money. We're in a cheap financing environment. Single B rated companies can issue 10-year debt secured debt under 5% and unsecured debt close to 6%. And last but not least, the impact of activist shareholders. So for example, Bill Ackman and Pershing Square teaming up with Valeant to try to buy a company for $45 billion. HMA being put in play by a activist shareholder, Glenview, who we represented last year, and then eventually being sold to Community Health Systems. And I think you're going to increasingly see activists taking a bigger role in pushing companies to think about M&A.
I think 2014 is going to be a pretty big and probably acceleratingly active year for healthcare M&A. I think part of the story of 2012 and 2013 has been uncertainty around healthcare reform, creating a pretty big gap between buyers and sellers. I mean, first of all, back in 2011 and 12, you had uncertainty around whether healthcare reform would really happen. More recently, it's been uncertainty around how it's really going to roll out when it's practically implemented. And I think what you've had is sellers who are very optimistic about some of the benefits of healthcare reform and incremental coverage and incremental dollars flowing into the system, creating seller optimism. And you've had buyers who are naturally going to be more conservative and more fearful about how that might really play out and whether that will really be as good as certainly some industry sectors hope it might be. I think as we're actually seeing it roll out in 2014, we'll have more data as to whether the bulls or the bears were right or wrong there. But in any case, as the uncertainty shrinks, I think the gap between buyers and sellers will shrink, and we'll see lots more activity in the space.
Well, everyone wants to be positioned as similar to the recent hot IPO, but really the best way, in my mind, for innovative companies to position for growth is really to focus on fundamentals. And that boils down to 3 things. First, focus on the customer. How do you serve the customer's needs, whether it's reducing cost, better customer service, better quality or outcomes. How you differentiate versus the competition is critically important. Second, be nimble. That's the innovative company's advantage. Healthcare market is very dynamic, sometimes changing in unpredictable ways, and emerging growth companies need to be more nimble than the competition and to react to those changes. That's their source of advantage. And finally, assemble the right team around the table. At the end of the day, the management team you have drives the quality of your execution, which drives the performance of the business. And while the needs for a management team might change at different stages of growth, getting the right team, a team around the table at each to match the execution requirements of the business is critically important to success and determines the outcome.
We're off to a really robust start to the M&A market in 2014. I think we're seeing overall M&A volumes up north of 50% globally. And in healthcare, it's actually up almost toward 5 times where we stood at this time last year. So I think the ingredients really are in place for an incredibly robust 2014 from an M&A market perspective. Those trends that are driving that are really some of the same trends that have existed for some time. That's low cost financing, strong equity market performance, a strong and robust IPO market, which is something we really haven't seen for a prolonged period of time since the credit crisis back in 2007. So I think the ingredients are all there, and I think how healthcare reform is really influencing that activity. Really, frankly, healthcare reform started impacting healthcare services, M&A markets over the last several years. I think the broader M&A market is really just catching up to the level of activity that healthcare providers in particular have experienced over the prior 2 years. So there's a little bit of a hangover effect for the healthcare provider universe here in the first part of 2014 as companies digest the activity and the volumes that transacted over the course of the last 12 months. But we fully anticipate the next wave of transaction activity on the healthcare services side in particular to involve more innovation, involve more growth-oriented business models. I think the first wave was characterized probably more so by developing regional scale and density, and I think the next wave is going to be preparing those providers and payers and equipping them with the tools and capabilities to handle the demands and the data collection processes that healthcare reform will require.